One of the major risks in a pandemic like COVID-19 is that hospitals will be unable to accommodate all of the patients who seek treatment. In areas where hospitals are overextended, death tolls are likely to rise. There are ways to alleviate this strain on medical resources. Other hospitals could send additional beds, or field hospitals could be constructed in areas especially hard hit. But the strategy of delivering resources reactively is a poor one. At NSSAC, we have simulation models that project which regions are likely to see COVID-19 outbreaks, how severe the outbreaks may be, and when they are likely to occur depending on different mitigating factors. In our COVID-19 Medical Resource Demand Dashboard, we leverage these projections to help government and public health officials identify areas where crises are likely to happen so they can plan accordingly. The dashboard provides visualizations that allow users to quickly see which regions are likely to see crisis conditions. There are 4 sections on the dashboard: the map, the chart, the timeline, and scenarios. The map illustrates which areas are likely to hit crisis conditions during the selected week by displaying occupation rates based on either the projected weekly hospitalizations or the percentage of occupied beds. The percentage of occupied beds is calculated with the general assumption that 80% of the total bed capacity of each region is occupied with non-COVID-19 patients, and that most hospitals can accept up to 120% capacity without hitting full crisis mode. You can also click on the selected regions to see projections for specific areas. The chart allows users to see how weekly hospitalizations are projected to change over the upcoming 6 weeks, and as a result, how the percentage of occupied beds is also influenced by the duration of the hospital stay. So while these 2 plots may rise and fall together, there may be cases where the weekly hospitalizations peak ahead of the percentage of occupied beds. You can download this data by selecting the Data tab and then clicking the Download button. Note that our tool shows projections and not forecasts. Projections attempt to describe how epidemic trends will behave over time depending on different conditions or the application of interventions. Unlike forecasts, which try to predict how many people will fall sick over a period of time, projections should be used as comparative trends to see more generally how case counts are likely to grow, when they are likely to peak, and which interventions may flatten the curve or cause the epidemic to peak sooner or later. The numeric values should not be taken as absolute or actual values because they rely on parameters that are beyond our control and are subject to change, like modifications to shelter-in-place orders or the number of people who wear masks. Also notice that the uncertainty bounds grow farther apart the further out we project. As is typically true of forecasting and projecting in general, there is greater uncertainty as we project farther into the future. The timeline serves 2 purposes. It allows people to see at a glance what the median hospitalization and percentage of occupied beds are projected to be for the selected area on the map, and it also allows you to select different weeks to display on the map. If I'm interested in Central Virginia, for example, I can see it may appear to peak at a moderate value in 6 weeks. However, if I see on the map that the northern region is going to be in crisis mode before that, I might anticipate that the central region may also go into crisis mode in the coming weeks. The chart and timeline are synchronized to the selected region on the map. Scenarios are calibrated simulation models that we use to run the simulations for our projections. They depend on known disease parameters, such as transmissibility and the number of people infected at the beginning of the outbreak, as well as the predicted effectiveness of different interventions and the degree of compliance with an intervention. For example, if a stay-at-home order is put into effect but only 50% of the people comply, then the stay-at-home order will be less effective in preventing disease than if 75% of people comply. Hovering over each scenario displays the details about that scenario. Scenarios are likely to change over time as different mandates are adopted, medical treatments emerge, and areas start to reopen. You can see how different scenarios are likely to impact the projections by choosing from the buttons at the top of the page. We will phase out scenarios and add new ones as information and treatments emerge. As you click on different scenarios, the dashboard will display how projections differ based on different assumptions and how different interventions impact the projections. Hospital durations are baked into the scenarios for the time being, and durations of longer stays are likely to have a larger impact on the percentage of occupied beds. However, durations do not impact weekly hospitalizations, as those reflect the projected number of people entering the hospital that week. Click the More Options button to learn more about this dashboard, our COVID-19 research, or our other projects. Thanks for watching.